for right now. Over the next 60 minutes, my colleague Jess Salentalo is going to give you an update on the website, and then we're going to hear from Dr. Hofi Conradi about Module 13, and then I'll close out the webinar talking about Module 14. So let me take my video off and ask my colleague Jessica to give us an update on the website. First of all, Jess, can you hear me? Are you able to can we hear you?
Yes, I can hear you.
Great.
And you can hear me. Perfect. All right. A good start to the day. Good morning, everyone. Thanks for letting me join. I'm very much looking forward to giving you an update on our website. Mike, you're driving, I assume?
That's right. You tell me when you want me to advance the slides and I'll do that.
Okay, go ahead. You can go to... So the purpose of this presentation this morning is just to kind of give you all a sense of where we are with the website, but also importantly, how it's meant to be used. The purpose of the website is really twofold. One is public facing, it's to provide a platform to share our goals that we're trying to accomplish through Stripe, and then also to highlight the achievements and the accomplishments of our partners with frequent updates, with photos, all the exciting things that we know will be coming our way over the course of the next couple months. And then for our partners, most importantly, the website will serve to enable access to materials, the Stripe version 2.0 that you all know is coming your way, and then any additional resources that you all need that we're hoping to pass on to you so we don't have to jam up your inboxes with huge files, have 3 different versions of Dropbox going at any given time. The purpose of the website is really to consolidate that process and have the most up-to-date elements ready for you all to have. And then the second is to conduct electronic evaluations. I'll go into that, at a very high level right now. We will be sure to have a whole session dedicated to electronic evaluations, but just to kind of show you how that will be hosted on our website and how that can be accessed is the purpose of today's conversation. And then, ideally with posting updates from you all, having a portal for you all to have, your different resources on the website. We hope that the website over time will become a way for partners to network, to see what others are doing. And so, Mike, you can move to the next slide. So the presentation will follow kind of, what I just laid out: accessing materials, evaluation, and then networking, so you can see how this will be done via the website. So for accessing materials, each of our partners will receive an email from our Stripe email address with login and a password. So you will then be prompted to, sign into the website. You can see this where this arrow is pointing. You sign in here and you put your username and your password. This will be something that you can share with others. It's not specific to one person. So that will enable you to become have different access within the site, including to the modules. So Mike, you can go to the next slide. Once you've logged in, you can download zip files for each of the modules. So under the sub-menu of modules, you'll be able to click on each of the individual modules, and when you click read more right here, it will open up a pop-up box that has the option to download module 5, and then that will download as a zip onto your computer. Next slide. Under the module menu, there are also some resources such as module updates. This is where we'll be populating what is different between version 1.0 and version 2.0, or if we ever need to upload, additional resources, we'll make sure that it's noted under the module update page, so that you have a sense of, what might be different from the last time that you downloaded the zip file. So that kind of gives us a map over time of changes. And then the roadmap page, you've probably already seen, very likely already seen our document that is a roadmap of the required modules and modules that may have more of an interprofessional focus, different content focus. There's an interactive element to this submenu that kind of helps map out the different modules and the different focuses of the modules. Then the idea for this is to help plan future trainings. Mike, you can go to the next page. And then under additional resources, we will have all of these webinars posted, and so and we will be building out this page over time once we hear from you all, what resources are needed, what you're using, but it's supposed to be a one-stop shop, so you don't have to look around for where this may be, where that might be. It should be housed under additional resources. So I'm going to move on to electronic evaluations, and just remember that you will be receiving, like all things with Stripe, you'll be receiving detailed instructions on how and when to access the modules, and you don't have to kind of go through this webinar again. You'll have it at your fingertips in case anything was unclear. So we will be the point of the website is to have one place where we can direct all of our partners to conduct electronic evaluations. We all understand that the value of the electronic evaluations is that it allows us in real time to be able to do some basic analysis. It takes the burden off of data entry and all of that. So we wanted to make sure that we were rolling out a standardized pre and post test, and that it was something that could be done, relatively easily across sites. So on the website, we will be prompting, and Mike, you can go to the next slide. There's a couple steps. So the first thing will be for the learners to sign up. So unlike our, partners, we will not be able to pre-populate logins for each person that will be taking, the Stripe courses. They will have to be doing this on their own. So the first step is for them to sign up to the website, and we're capturing information that we'll want to be able to use to analyze the results and disaggregate the results. So it's pretty simple: first name, last name, their school affiliate, their clinical sites if applicable, and then training level, health professional category. And once they submit this form, they provide their own username and their own password. They submit this form, and then they enter the site and sign in the same way that you all do. And then Mike, you can go to the next slide. And then under the evaluation submenu, there will be a pre and a post test available to them. And that is where they will take the pre-test. They will go through, the training course with you all, and then you will redirect them back to the website to take the post test. So pretty streamlined. But I see that there's someone with a hand. Mike, do we take questions now, or should I continue? And
I think that hand has been up before. So certainly, if folks do have questions, then please let us know. You can put them in the chat box now. Alternatively, we'll give over some time at the end of the webinar. So if you want to save up your questions and share them in 20, 30 minutes time, that's also fine. But if there are any questions right now, let me know. Otherwise, we'll transition to the next module.
Okay. So just to complete, we have electronic evaluation. You can go to the next slide, Mike. So the purpose, obviously, as you know, as I just explained, is to facilitate real-time data capture and minimize, data entry for each of our partners. But we all know, that there will be times, there will be sites, and always issues that we need to be ahead of. So there will be paper tools available also on the website for sites that won't have reliable internet access. And we're very much interested in working with each of the sites to ensure that whichever route you take, the electronic data capture or paper-based data capture, that it's done, with our support and seamlessly, since this is very important information for us all to have at the end of our implementation period. So you can go to the next slide, Mike. And then for partner networking, this is just really a heads up. There is a portal. You can go to the next slide. The website provides a bit of a summary from each partner and the team members that you all shared in your initial submission back in June, I believe. There's so much opportunity to expand with photos, with reports, any best practices that you want to be, providing for us and to be sharing with others. We will, welcome that and be able to host it on our website. This will be something that I think will build out over time, but, just something for you to have in mind. So you can go to the next slide, Mike. The kind of just a summary, we're finalizing the website. It's a work in progress. The goal is for us to upload all of modules 2.0 onto our site and then send that out to you, the links out to you by early next week. And we can provide updates with any, issues with that timeline. And then, as I had already mentioned, that you all will receive a login and email address as soon as it's live. And then also, I'll just do an intro video, kind of similar to what I've done now, but for you all to share with anyone who is not able, to join this call, or if there's elements that, I want to just highlight. That will be available to you as well. And as always, you can, direct any questions to our Stripe address. Okay, I see that there is a question. If you want to open up the chat box, Mike, I'm happy to answer those now.
Yeah.
Or later.
Yeah, so one question from Shadrach. Will these pre and post questions change time after time? Will they be the same questions? And then from the team in Nigeria, will the evaluation be the same time for all the sites or when each site implements the training?
So the second question, it will be based on your training schedule. So our idea is, you meet with the learners at the very beginning of of your training session. You have them take the pre-test, you go through the tests, and then, but at the very end, before they leave, please have them take the post-test so it's done site specific. And then the first question was about, will they change? The idea is that, obviously we want to do like a one-to-one comparison between pre and post. So it's going to be the same questions. Obviously in the early, sites will probably be doing, as much analysis to understand if there are any issues with the questions, if there's confusion. So I won't say that they won't change over time at all, but the idea is obviously, that the learners take the same pre and the post and that there are as few updates as possible to, have the highest number of sample size of people who have taken the test over time. Let me just make sure that I answered those questions sufficiently. Is that clear?
Yeah, I think so. I think the other thing to to add, Jess, is that our vision is that the pre and post test evaluation will focus on the main sort of required modules. There will be additional questions that you can ask the learners about the other non-required modules, but those won't be collected and part of our reporting. Is that correct?
So essentially what, and this will be further down the line when we talk about evaluation in a bit more detail, but that's correct. We will be making sure that all of the learners answered the required modules. All of those questions on our pre and post test are required, so you actually can't submit the form until you have answered all of those questions. And then there's a breakout, for anyone who feels like overachieving that day or really giving us, some more information, which we would be so excited to collect. There is an optional tab for them to be able to answer 2 questions and again, we can walk through that in a bit more detail the next session.
Great. Hey, thanks, Jess. I mean, one thing to say is that it's really exciting to see the website come together, and thank you for sort of coordinating with that. The other thing is to emphasize that the website will be sort of linked to and part of the AfriHealth website, correct?
Definitely. Yep, we will be linking between the two, and over time we hope to move it entirely over to the AfriHealth website. So that is our goal.
Great. And just remind us, when are we hoping to go live?
October 1st is our date, and we can keep you updated with any issues. I'm confident that components of it will go live, and then we'll just have to let you know, like as Stripe 2.0 is populated on, we'll just have to kind of let you know what's available and when.
Perfect.
Yeah.
Thanks, Jess. If okay, it'd be great to have you hang on the line. And so if there are any questions at the end of the webinar, we can circle back to this.
I'm excited to see 13 and 14. I'm happy to stay on the line.
Thank you. Well, great. Without further ado, then let me hand over to Hofi Conradi. Many of you will know Hofi, a clinical professor at Stellenbosch University and an expert in health education and training trainees in rural and family practice medicine. Hofi's going to talk to us about Module 13. Hofi, you on the line? Can we do a quick sound check?
Yes, I hope I'm online.
Perfect. Yeah, lovely. Loud and clear. So over to you, Hofi. Can you tell us a little bit about Module 13?
Okay, can we go to the first slide? Yeah. So this module is really about giving the participants an idea of how the health system affects the care of patients with HIV. And to do that, we start off with a patient scenario where a patient goes to the local clinic and finds out that the medicine is out of stock, and now she has to travel a considerable distance at expense to go to the nearest district hospital to get her medication there. And she arrives at the hospital irate at all the trouble she had to take, and we then consult with the patient in her unhappy state. So could you go to the next slide? So there are the objectives and the activities. So the first objective is then to have a psychosocial support for the patient in her angry and upset state. And the activity we have there is to provide the participants with this scenario and then give them an introduction to communication, and then ask them to role play in pairs, one playing the frustrated patient and the other one the healthcare provider, and feel what it is to be in that position, both from the patient's side and from the healthcare provider's side. And then there will be a feedback session as well to see how those interactions went. The second objective is then to understand the implications of the unavailability of the drugs for the patient and the clinical outcomes specifically. So there's then a group discussion in each small group to discuss the consequences of the stock out for the patient, Sarah, on what is the effect on her clinical condition as a HIV positive. What does it mean for her financial state? What does it mean for her social interactions at home and having to travel so far? So that after the small group discussions, then there would be feedback to the whole group. Then the third is to introduce the participants to the World Health Organization 6 building blocks. Mike, can you go to that slide? Yeah, so there you can see the 6 building blocks: service delivery, health workforce, health information systems, access to essential medicines, financing, and leadership and governance. And we will ask the participants then, we'll provide them with a paper to write down each one of those building blocks, what actually could happen or could go wrong in providing a constant supply of drugs to the clinic where the patient receives her medication. And we will discuss those different aspects and ask the participants to come up with the most common reasons. So can you go back to the previous slide, Mike? So the next activity is then to do a fishbone diagram to then look at those building blocks and identify the possible gaps that can lead to a stock out. Mike, can you go to the fishbone diagram? So there you can see the fishbone. So each of those 6 building blocks are on the ends of the bones of the fishbone, and then the participants will be asked to fill in under each of those bones what could possibly lead to the stock out, and then to give us a better understanding of what could lead to the stock out. And the participants will then also share their from the small groups to the whole group, share their fishbone diagrams and identify then the 3 most likely reasons why there could be a drug stock out in their specific clinical facility. Mike, can you go back to the objective slide again? And then the last activity then, which is again a group discussion, we go back to where we started, to the angry patient, and hopefully by now we have a better relationship with the patient, and we now have to sit down with her and say, what can we do in this situation? What are our options now to provide her with a supply of the ARVs that she so much needs? Okay, can we then go to the last slide, Mike? Yeah, just to the questions then is, the learning methods that we are employing is both small group discussions, also the role play between 2 participants, and then also filling in the implications of the drug stock out on the fishbone fishbone diagram. I think this module is ideal for interprofessional education because it involves many participants, both at clinic level, at hospital level, and also at a higher level, and involves different disciplines from the professional nurse practitioners, the doctors that are involved, the pharmacists, the administrative people who provide the logistics for transport, the pharmacists at a higher level, ordering and providing the drugs. So it's an ideal module to look at the different roles of the different health professions. And then lastly, it introduces the participants specifically to the fishbone tool in quality improvement. Thanks. I think that's it.
Great. Thanks, Hofi. Fantastic. Really appreciate your summary of this. I agree. I think this is a really excellent module and nicely put together. So thank you for leading on that. Again, I'll let people have the opportunity to ask questions if there are any. Otherwise, maybe Hofi, we can have you stay on the line, and if there are questions, we can answer them at the end.
Yeah. Good. I'll certainly stay online.
Thank you. Well, so then let's move on to module 14, and I'm going to share this module with you all, or sort of apprise you of this. And in many ways, this builds on module 30. The two are distinct and unrelated, and like all the other modules, you know, should be or can be delivered as a standalone training event without having to undertake any of the other modules concurrently. But this also deals with sort of the health systems framework for delivering HIV, and specifically around the importance of differentiated or patient-centered service delivery models. And so we focus on the two stories in this case. The first is a gentleman, John. He's a 35-year-old gentleman who comes to his regular HIV outpatient appointment clinic, complaining that his clinic is too far away. He lives in a small village and would prefer to receive care closer to his home village rather than traveling to the main HIV clinic at the large district general hospital. He's an example of somebody living with HIV who is doing well on treatment. His viral loads have been undetectable for 7 years, and I think that's important and something that gets unpacked in the case. And then the second is a case of Mary. She lives in a rural village, also close to John, and walks 2 hours every day to pick up her meds. And you know, the vignette is unpacked and in such a way that you learn that she went without meds for a period of time because of unpredictable weather that made access to her local dispensary problematic. And so we use these two vignettes to sort of help the learners think through and have acquire a better understanding of the different levels of healthcare that are available, the importance of community level care, as well as, importantly, the crucial role that different healthcare providers play at different levels of the healthcare system. And then recognizing that much of HIV service delivery is done by stakeholders from within ministries of health, from academic institutions, as well as from NGOs that are funded by outside funders like PEPFAR. We want the learners to understand who are the different organizations that are involved in supporting people living with HIV. And again, this is a great opportunity, not so much to talk through the different professions involved, but the different kind of stakeholders that are involved in delivering HIV care. Faith-based organizations, community groups that work with key populations, etc., and providing the learners with an opportunity to think through this is what this objective is focused on. Objective 4 is about helping the learners understand the different challenges in delivering high quality care, both at a community level and at the patient level. And so specifically what happens in this activity is that the learners understand a little bit more about the challenges of delivering care in the district where John and Mary are both situated. And we hear about Andrew, who is the district HIV manager, and he's just attended a national review meeting where there's been concerns raised about poor ART retention in his clinic. And healthcare workers in his district are complaining that they're seeing too many clients each day and they're burnt out and feeling overburdened. And so this is an opportunity for learners to kind of think through what are the factors that Andrew as the manager has to think about, what are the strategies that he could employ to address the challenges he faced, both in terms of the needs of his healthcare workforce, avoiding burnout, as well as optimizing delivery of care for patients that are not being retained or that are being lost to follow-up. So we asked the learners to kind of think through what are the contextual factors, being urban versus rural, high HIV versus low HIV, that would impact how Andrew might think about these issues. And then in this, the same activity, we consider the case of Jane, an HIV nurse, who is delivering care in that same district, and she knows many of the clients that are a bit like John, who have to take a lot of time off work to attend clinics, and we want to find out, how we can deliver care, or rather how Jane can deliver care in a way that is responsive to the volume of patients that she's seeing and her sort of personal psychosocial needs as a healthcare provider in that situation. So those are some of the things that get addressed in activity 4. We also ask the learners to consider, what are the barriers that a patient like John faces, and how could more patient-centered care be offered to him. And the strategy for helping learners to come up with this is really group discussion. So we there are a list of questions for the providers, for facilitators, to engage the learners around these 3 different people, Jane, Andrew, and John, in terms of thinking through what the barriers to care are in their situation. We then move in objective 5 to a more specific discussion of differentiated service delivery models and their importance to ensuring high quality patient-centered care in different situations. And any of you that are engaged in HIV service delivery in your countries will already know about differentiated service delivery models that are very much, emphasized as a crucial strategy for improving delivery of care for folks with HIV and indeed for other chronic diseases in settings where there are, constrained resources or limited healthcare professionals to deliver those resources. And so in activity 5, we actually share with the learners a set of different models for differentiated service delivery and ask them to kind of look through them, discuss these different models, and then recommend a model that might work best for John. And briefly, I'll just mention these. Personally, I think this is a really interesting area of HIV sort of public health and service delivery. So if you're not familiar with these models, take your time to look at these. I think it's really interesting. But we look at medication adherence clubs that have been highly successful in Kenya as a mechanism to ensure that stable patients with HIV don't have to attend clinic as much and can meet with other peers rather than attend clinic every month. We talk about community ART groups, which have been successful in places like Mozambique, and they afford the opportunity for stable patients to participate in community groups where they attend facility visits together, and again, don't necessarily come to individual level patient visits as frequently. We study the example of harm reduction clinics that have been used in Mauritius, and then the distribution communautaires, or PODIs, in the DRC, which again is another model that has been used to offload those very busy central HIV clinics. So the idea here is to have the learners spend a few minutes discussing these different models and then coming up with a strategy that might work for John. And there's no right answer here, but the idea is to kind of just have them think through this lens. As you know, many of these learners are like entirely embedded in clinical learning. They're understanding, you know, basic meds and basic treatments for HIV, and so looking through this different lens might be a fresh challenge for those that have not done any public health before this. So that's activity 5, and then moving on to activity 6. The idea here is to try and address Mary's problem, and we hope that this activity will enable the learners to be able to deliver sort of a more interprofessionally focused, patient-centered plan. And so, you know, as I mentioned at the beginning, this vignette focuses on Mary, who's walking a long way every day to get to her nearest clinic. And last year, she actually had to go without meds for 2 months because the river that she has to cross to get to her dispensary was flooded. And so we asked the learners, what are the challenges that Mary faces in accessing care? What strategies or different models could be employed to assist her? And here, we want the learners to sort of understand the importance of decentralized care more generally, and we refer to the WHO guidelines on decentralization. So they specifically recognize the value of decentralized HIV care for initiation of ART in hospitals with maintenance of ART in peripheral health centers, the potential for maintaining people on ART in peripheral clinics, etc. And so after a discussion around the WHO guidelines on decentralized care for HIV, we asked the learner to suggest a solution for Mary that can allow her not to have to walk so far so frequently. And we proposed that that strategy be implemented. And so that moves me on to the final activity, which really is around sort of thinking about these different models through a quality improvement lens. So the case fast forwards, we propose that these new models of care are implemented to better support John and Mary, and we suggest that Andrew, recall he's the district HIV manager, wants to assess the impact of these changes on clinical outcomes. And so how could the learner come up with a set of metrics or indicators that would allow Andrew to understand whether these differentiated service models are improving care for John and Mary? So we're not asking the learners specifically to develop a QI tool, but really to think about what are the kinds of metrics that could you look at to assess whether quality is improving or not. So patient level metrics, could you look at the number of people in that new model with a suppressed viral load, or the time that patients spend in the clinic with the nurses, or system level metrics? How many times are patients actually going to their clinic visits versus what they're expected to? What are the waiting times for patients in the clinic room? And importantly, again, thinking through a sort of a holistic interprofessional lens, does this improve the quality of life for the frontline providers, for nurses and other staff? So staff satisfaction surveys, looking at staffing models or staffing requirements, retention rates. These are all ways that one could assess the quality of care in these differentiated service delivery models. so those are just some examples of the, the kinds of discussions that we expect to unfold out of activity 7. Oh, and yeah, so I think I forgot about this slide at the beginning, but this is one of the early slides, early in the course of the module. We want learners to kind of understand who are all the stakeholders and what are the different levels of health system that are involved in ensuring HIV care. And so we highlight here where different health professionals, particularly frontline HIV providers, sit within the healthcare system. Look, I know that you as health educators understand this, but I think sometimes learners don't fully appreciate the kind of the complexity and the different dimensions of HIV service delivery. So these slides afford them an opportunity to understand that. So briefly, and I'll wrap up here because I want to make sure we have time for questions for Jess and Hofi. Vis-a-vis module 14, what are the learning methods employed? The main learning method here is that we're using sort of small group discussions. We refer to some useful resources, so we want them to interface with some secondary data and use some evidence-based tools. These different models that we share for service delivery. What is the core content? I think the core content here is helping the learners to understand that there are different ways of delivering high quality care, and as we are moving into a sort of a chronic HIV service delivery model that can provide lessons for other NCDs. How can that be structured in a way that is responsive to the challenges in each country and each geographical and epidemiologic context? What are the essential IPE tools that we're deploying? Here, we're really trying to help learners understand that the different roles and responsibilities that different healthcare professionals focus on, and the importance of a team-based approach to delivering high-quality care, but at the systems level rather than at the patient level. And then, what is the QI method addressed in this module? Well, as I said, we're not jumping into a specific QI model per se, but really just trying to help learners think about, if I wanted to assess the quality, what are the kinds of metrics that I could look at? So it's, again, one level up from doing a QI assessment, but clearly crucial to undertaking that. So I think that's me, done here. Let me ask if there are anybody on the line that has any questions for Hofi, myself, or Jess. So actually, it looks like there's a question here from Hofi that I'm going to direct to you, Jess, and it's really related to the evaluation piece. And I know that this is a work in progress, and that things will evolve over time. But during the workshops, Jess, will we provide a paper version of the learning module for participants to complete? Any response to that you want to share?
Hofi, you can clarify. I think this is about the module, like the learner version of the module, not the pre or post test. Is that correct?
Yes, that's correct. So it means that we will have to print out the learner module for each participant so that they have that and can fill in those. I don't know whether it also holds for some of the other modules.
That's a great question. I guess then maybe I should answer that, right, Jess? But I welcome your thoughts. I think our expectation is that where there is, where we expect learners to sort of move through a set of questions, that they will be printed out, because there will be opportunity for many of the modules for them to handwrite their responses. If paper is a scarcity, then obviously they could share the learner guides amongst themselves. But certainly the idea was that we would print out and give each learner a copy of the learner guide. Yeah. So then, Hofi, I think there's another question here from you. Would it be perhaps possible to do module 17 next week, as it's a core module? We could certainly, yeah, I think that's reasonable. Let Cheyenne, who's not on the call right now and is really leading on these webinars, let me liaise with her. I think that certainly might be possible. So yeah, watch this space. Maybe we can make sure that happens, because I agree it's a core module and should be addressed as a priority. Any other questions? All right. As I wrap up, then, you know, this is your final opportunity to add a question in the text box. You can always email stripehiv@ucsf.edu or myself if you have any other questions. We will have another module, same time, same place, next week. And we look forward to your participation in this. And as I said at the outset of this call, it is really exciting to hear about the progress that you are making and the training that you're doing. And I guess, you know, we here in San Francisco have the privilege of hearing about some of the early successes, but you know, congratulations to those schools that are already up and running and doing their trainings, sharing these resources with faculty and even learners in some settings. You know, kudos to you for really doing such a stellar job of making this training work in your settings, and just a huge thanks from the UCSF team for being willing to partner with us, even at relatively short notice and with the sort of very challenging timeframes. We are continually inspired by your energy and enthusiasm. I will end there. Again, thank you all for joining the call, and we look forward to connecting with you same time next week, same place. All right, goodbye to you all.
Bye, Mike.